Welcome to the Maryland Prescription Drug Monitoring Program portion of this training. The PDMP is established by Maryland state statute and is administered by Maryland's Department of Health, Mental Hygiene, Behavioral Health Administration's Office of Overdose Prevention. All legally authorized clinical users register for and access PDMP data through CRISP, which you have just learned about. Rules around who can access PDMP data and under what circumstances are slightly different than some other CRISP policies, so this section applies to PDMP data in particular. Drug deaths now lead all other causes of injury deaths in the U.S., outstripping both firearm and traffic fatalities. The number of drug and alcohol-related intoxication deaths occurring in Maryland increased in 2015 for the fifth year in a row, reaching an all-time high of 1,259 deaths. 86% of all intoxication deaths that occurred in Maryland in 2015 were opioid-related, and the number of opioid-related deaths have more than doubled since 2010, increasing 23% between 2014 and 2015 alone. People who take prescription opioids medically for pain can become dependent on them and begin to misuse them, and some may transition to or supplement with heroin or other substances. Among new users of heroin, approximately 75% report that they started using the drug after first using prescription opioids. Opioid-related fatalities have been on a steep incline in Maryland, driven in part by large increases in the number of heroin and fentanyl-related deaths. Most fentanyl-involved overdoses are attributed to non-pharmaceutical fentanyl produced in clandestine laboratories and mixed with or substituted for heroin or other illicit substances. Fentanyl is many times more potent than heroin and greatly increases the risk of an overdose death. While overdose deaths are by no means the only way to display the impact of the prescription drug epidemic, characterizing the causes of these fatalities in Maryland is instructive, especially from the public health lens. Almost every state has a PDMP. While there are commonalities between PDMPs, each state's statute, regulations, and policies do differ. The first goal of the Maryland PDMP is to assist medical, pharmacy, and public health professionals in the identification and prevention of prescription drug abuse. The PDMP is also tasked with assisting law enforcement and regulatory agencies in the identification and investigation of illegal prescription drug diversion. Finally, overarching all of the PDMP's activities is a goal to promote a balanced use of prescription data that preserves the professional practice of healthcare providers and legitimate patient access to optimal pharmaceutical care. The Maryland PDMP is a secure, statewide electronic database that contains information on all controlled dangerous substances, or CDS, Schedules 2 through 5 dispensed in Maryland. By state law, the program is authorized to disclose collected PDMP data to a number of users, including healthcare providers like yourself. The PDMP is a clinical tool for prescribers and pharmacists in the medical care of patients. The program gives healthcare providers real-time electronic access at the point of care to their patients' complete Maryland CDS prescription history to identify aberrant drug-using behavior, improve providers' ability to identify possible substance use disorders and refer to appropriate assessment, treatment, and recovery services, improve providers' ability to safely and effectively manage patients' pain and other conditions with CDS pharmacotherapy, and increase confidence in prescribing decisions and patient compliance and decrease potential for harmful drug interactions. It takes a collaborative team effort to combat the opioid epidemic in Maryland. DHMH has partnered with CRISP to make CDS prescription information available to clinical users. CRISP is the only authorized source for a provider to access PDMP in Maryland. Clinical users may access PDMP data through the CRISP query portal or through electronic medical record integrations at certain healthcare facilities across the state. CRISP provides user registration and technical support services for clinical users. The final team member is the dispenser, the pharmacies and individuals who are required to report prescription records into the PDMP. Within 3 business days of dispensing a medication in Schedules 2 through 5 as defined by federal, state controlled substance laws, Hospital outpatient pharmacies, community retail pharmacies, mail-order pharmacies sending CDS prescriptions to Maryland addresses, and practitioners authorized to dispense CDS prescriptions must electronically report identifying information about the patient to whom the medication was prescribed, the prescriber, the dispenser, and the drug itself. Upon promulgation of new regulations in the near future, dispensers will be required to report daily to the PDMP, thus allowing more timely access of data to providers. There are reporting exemptions that are important to know about when viewing PDMP data and making clinical decisions. Direct administration of medications and drug samples are not reported to the PDMP. Entities exempted from reporting include pharmacies who serve only hospital inpatients or who are waivered by the Board of Pharmacy for serving exclusively assisted living, comprehensive care, and developmental disability facilities. Also, with a waiver, pharmacy dispensing to hospice inpatients is exempt from reporting. Opioid treatment programs, including methadone programs, are also exempt. Federal Regulation 42 CFR Part 2 protects the confidentiality of drug treatment records. Reporting to a state PDMP would put OTPs in violation of this federal regulation, and thus dispensing that occurs at these programs are not available in the PDMP. Veterinarian dispensing is exempt unless a prescription written by a veterinarian is taken to and filled by a retail pharmacy. We advise some caution should be taken when interpreting PDMP data. PDMP data are records of dispensing as reported and should not be considered the official record of a dispensing transaction. Only the original prescription can serve as the official record. Although all efforts are made to ensure data accuracy and completeness, reporting may contain errors or omissions. This may result in missing or incomplete records or multiple profiles in CRISP for what you might believe is the same person. If a dispenser confirms an error or omission in PDMP data, then please contact the PDMP administration by email at dhmh.pdmp@maryland.gov or by phone at 410-402-8686. Clinical users authorized to access PDMP data are grouped into three categories with specific definitions: prescribers, pharmacists, and delegates. Delegates will be described in the next section. Prescribers are any practitioner authorized by law to prescribe CDS in Maryland. The terminology differs slightly from what we use to describe clinical user access to other CRISP data feeds. If you have questions about who can access PDMP data and who is subject to any PDMP-related mandates, please refer to the PDMP page on the CRISP website or with the DHMH PDMP website. The following are the terms of legitimate access and use of PDMP data. Prescribers and licensed healthcare practitioners delegated by a prescriber may access PDMP data in connection with the medical care of a patient. Pharmacists and licensed healthcare practitioners delegated by a pharmacist may access PDMP data in connection with the dispensing of a CDS medication. PDMP access is available to all who meet the definition of prescriber or pharmacist. However, as you have previously learned, clinical data access may be limited based on organization affiliation and CRISP policies. Starting October 1, 2016, delegates can either be licensed healthcare practitioners without individual prescriptive authority or other staff members who are employed by or under contract with the same professional practice as the prescriber or pharmacist. Prescriber delegates and pharmacist delegates may access PDMP data on behalf of a delegating prescriber or pharmacist. Please see the PDMP and CRISP websites for more information about delegate roles. A person who knowingly discloses, uses, obtains, or attempts to obtain by fraud or deceit PDMP data in violation of Maryland's PDMP statute shall be guilty of a misdemeanor. In addition, a prescriber or pharmacist who knowingly discloses or uses PDMP data in violation of Maryland PDMP data statute shall be subject to disciplinary action by their appropriate licensing board. HIPAA applies to PDMP data, but there are additional legal considerations you should be aware of. PDMP data are confidential, privileged, not subject to discovery or subpoena in civil litigation, and are not public records. The release of PDMP data by a prescriber or pharmacist to another licensed healthcare professional solely for treatment purposes and in a manner otherwise consistent with state and federal law is protected under the PDMP statute. A main goal of the PDMP is balancing appropriate management of specific conditions for which CDS medications may be indicated with risks associated with controlled substances, including addiction and overdose. As you begin accessing PDMP data, you are bound to find information of note that may impact the type of care you choose to provide your patients. The Maryland PDMP recognizes the need to equip clinical users with the resources to address issues uncovered through viewing a patient's PDMP data. Aberrant drug-taking behavior, formerly called drug seeking, may be observed through red flags within the PDMP data, such as early refills, overlapping prescriptions, or multiple similar prescriptions from different prescribers. Red flags for overdose risk may also be apparent in the PDMP. For example, high-dose opioid prescriptions or concurrent prescriptions for opioids and benzodiazepines. Talk with your patient about what you see in their PDMP data and consider whether screening for a substance use disorder, referral to an applicable specialist, or prescription for naloxone may be warranted. There are many resources available which may be of help to you. To access these resources, please go to the Clinical Resources tab on the Department of Health and Mental Hygiene's PDMP webpage. For more information about the PDMP, including legal or policy questions and clinical provider resources, please visit the Department of Health and Mental Hygiene's PDMP website or email or call the program. For technical support registering or accessing the CRISP query portal, including PDMP data, please contact CRISP support by phone or email. Thank you.
By visiting www.crisphealth.org, you can view the complete list of organizations that participate with CRISP. Once on the home screen, select Connected Providers on the menu bar. This chart allows you to see who is sending data to CRISP, the types of data they are sending, and when they began to send data. To access the portal, visit www.crisphealth.org. In the upper middle section, click the Login button to be taken to the Query Portal login screen. At the login screen, insert your username and password and click Login. Next, you will be brought to a screen with your security question. Type the answer to your security question in the answer box and click the Verify button. Once accessing the portal, a patient search box will automatically pop up on your screen. Please note that you must include a search reason for the drop-down menu. Treatment will be selected for you by default. Search your patient's information under the Demographic Search section. You must type in both the patient's last name and the date of birth. Then click Submit. The other fields are optional. You will then be brought to this screen where your search results will be shown. Note that if you have multiple patients found, you should confirm the correct patient using their address. Once you have found the patient you want, click on their name to take you to their information. Your patient's clinical information can be found on the Summary tab. Here, you can view prescription drug monitoring data on the Medication section. Click on an entry to view more information. Imaging will show you the results from radiology reports. Here you can view the exam results. Care alerts and other documentation can be found under the Documentation section. Again, simply click on an entry for more information. Ambulatory encounters will show you data from doctor's visits. Inpatient encounters will show you patients' hospitalizations. You can view lab results on the Laboratory section. Note that abnormal results will be marked with a colored arrow. under the Patient Actions menu, on the upper left-hand corner of your screen, provides you with the option to download your patient's clinical information. To download CCD or download CCDA, you must insert a start date and an end date. You can manually type these dates into the boxes provided or use the calendar icon to select the dates. Click Download, and the data available between the inserted dates will begin to download to your system. To download your patient's data in a PDF format, select Download Summary PDF from the Patient Actions menu. A pop-up box will appear. You must insert a start date and an end date, and select the Download button. The PDF will begin to automatically download. Next, if you would like to change the layout, click on Configure Layout. You can drag clinical sections and arrange them the way you want. You also have the option to stack multiple sections. These sections will show like tabbed folders. You also have the option to filter and display the patient's data by specific dates. Select Filter Displayed Items by Date. Provide the start and end date for which you would like to filter the data and click Submit. The data will automatically filter. To access your patient's advanced directives, select Request Advanced Directive. If this patient has submitted an advanced directive to the site mydirectives.com, you will be able to access them here. mydirectives.com is a public website that Maryland has set up in partnership with CRISP. However, it is a third-party site separate from CRISP. Select Get Directives. If there is an advanced directive available for this patient, a link will be provided to it. If you have the security to see Maryland PDMP data, Interstate PDMP data will also be available here. Along the top tab, select Interstate PDMP. You will see the section for out-of-state prescriptions. You can see full details of the prescriptions filled in this chart view. Our training environment is set up only to view prescriptions filled in Kansas. However, in the Production CRISP Clinical Query Portal, you will be able to see the full list of out-of-state PDMP medications. To search additional states, click on the magnifying glass button below the chart. Begin typing in the abbreviation for each state you would like to add and select the state by clicking on the name. You will now be able to view the available prescription data for those states. Prescription data can be printed by selecting Print Medications from the Patient Actions tab. Some states do not allow their prescription data to be printed, and those states will be listed in this blue highlighted message box. For all approved states, insert the dates between which you would like to print prescription data. You can also select to print all medications, Maryland only or out-of-state medications only. By clicking Print, you can preview the PDF of the medications prior to printing. The Patient Care Overview tab can be located among the tabs to the left. Once clicked, you will be brought to the Patient's Care Overview. The first section of data will show you the organizations that are subscribed to that patient through the CRISP Encounter Notification Service. You'll be able to see if the patient is participating in a care program with that organization, information about the care program, and the program manager's contact information. The next section displays care alerts, which are also available on the Summary tab. Here, you will see the facility that provided the alert, the date the alert was created, and then the alert content. If there have been any recent encounters that the patient has had, whether in the emergency room or an observation stay, or an inpatient admission, these will also be displayed. The following section will display the patient's known chronic conditions and various visit information. Thank you for watching the CRISP Clinical Query Portal training video. If you have any questions, please contact CRISP at 1-877-952-7477 or via email at support@crisphealth.org.